Hello, my name is Lorraine Ware from Vanderbilt University Medical Center, and I am one of the researchers leading the ARDS, pneumonia, and sepsis study being conducted all over the country. We call this the APS study for short.
Hello, my name is Donald Alcendor, and I'm a researcher in microbiology and immunology at Ware Medical College, which is also working on the APS study being conducted all over the country.
We wanted to tell you about a study of serious health conditions called acute respiratory distress syndrome, pneumonia, and sepsis. Acute respiratory distress syndrome, or ARDS, is a condition that happens when your lungs fill up with fluid because they are injured. When your lungs are filled with fluid, they can't fully fill up with air. This means less air or oxygen reaches the blood and organs. This can make the organs stop working as well. Pneumonia is an infection of the lungs. Like ARDS, pneumonia can cause your lungs to fill with fluid, making it hard for oxygen to reach your blood and organs. Sepsis happens when the body's immune system has a serious and harmful reaction to an infection or injury. Sepsis causes inflammation all over the body, and this can cause tissue damage and organ failure. Acute respiratory distress syndrome, pneumonia, and sepsis can be very hard to treat. Learning more about the patients with these conditions can help us understand the underlying problems of these diseases and how to better treat them in the future.
The goal of this study is to learn a lot more about these illnesses and the ways the body is affected by them by recruiting 4,000 people across the country with these conditions to join our study. This will help us learn how we can make future treatments better and more personalized. This video will tell you about the study to see if you would like to be one of those 4,000 individuals. Study participation is up to you.
Thank you for taking a moment to learn about the APS study during this difficult time for you and your family. I have been treating patients with these diseases for many years, and it is always challenging. My patients often have other pre-existing chronic illnesses that make being hospitalized even more serious for them, and sometimes patients can experience rapid decline. I'm hopeful that the information collected in this study will teach us things about the conditions that will eventually help providers like me care better for people in the future. So, we're inviting patients to take part in this study who are currently hospitalized with ARDS, pneumonia, or sepsis by collecting different samples and test results. I can assure you that there are no experimental medications in this study, and taking part in this study will not interfere with the clinical care you are getting. When patients are currently too sick to agree to join the study, their alternative decision maker, or surrogate decision maker, may give permission for them. We've created this video to help explain the study so you or your loved one can make a decision about participation.
We really want to better understand the risks, traits, and how the illnesses like ARDS, pneumonia, and sepsis gets worse over time. With support from the National Heart, Lung, and Blood Institute and the National Institute for General Medical Sciences, we will enroll about 4,000 people in the study. If you decide to join, here's what will happen. During and after your stay at the hospital, we will collect information like your contact info, medications you are currently taking, and clinical lab results from your medical records. We'll also ask you some questions about your current illnesses and medical history. While you're in the hospital, we'll collect things like your urine, blood, and stool samples, and also nasal, oral, and rectal swabs. If you're put on a breathing machine, we'll also collect a small amount of fluid from your lungs if it's safe to do so. Collecting these samples and testing them in the labs will allow us to identify some of the medical characteristics of patients with ARDS, pneumonia, sepsis, and better understand reasons these conditions get better or worse during treatment. We believe this information will help researchers develop better treatments in the future.
Also, it's important to explain that these conditions can sometimes cause longer-term problems as people recover. So after you leave the hospital, we'll send 3 surveys to you by text message and email to ask about how you're doing at about 3, 6, and 12 months after you leave the hospital. If you're not able to complete the surveys online, we will call you to complete the surveys over the phone. These surveys will ask you questions about how you're doing overall, such as your quality of life. You'll be asked to complete the surveys 3 times over the course of 1 year. You will be compensated for your involvement in the study. You may also have an opportunity to participate in additional research alongside these surveys to better understand recovery during the year following your hospitalization. The research team will share more about this if you're eligible.
All information that you provide as part of this research study is kept private and confidential. Only the research team will have access to your information. Your name and other information that directly identifies you will be stored separately from your health information. If you decide to participate, your health information and study participation will be protected under Certificate of Confidentiality. This means we can protect this information and not release it even if requested for most legal reasons. Participants' privacy is very important to us. While unlikely, as with any information collected online, there's a minimal risk that someone outside of the team could get access to the study, information that we have stored, and maybe misuse it. We think the chance of this is very small, but we can't guarantee it will not happen.
There may also be some soreness and discomfort when blood, urine, and swab samples are collected. If you are on a breathing machine, we may also take some fluids from your lungs. Taking fluid from your lungs is done through a procedure called non-bronchoscopic bronchoalveolar lavage, also known as NBBAL. These fluids might help us learn even more details about the disease you are experiencing. We get these fluids by placing a suction tube into your breathing tube with some fluids and gently suctioning the fluid back out. We may also take a sample from the tube that connects your body to the breathing machine. This is called a tracheal aspirate. While the risks are rare and unlikely, you can pause the video to learn more. The consent form has additional information about risk, and you can ask the study team if you have any additional questions.
Without volunteers like you, healthcare would not improve. The treatments, medicines, and medical technology we have today are because of research. If you choose to join the APS study, your participation will truly help guide the future of ARDS, pneumonia, and sepsis treatment. There is no direct benefit to you by taking part in this study. People have many reasons why they may want to participate, but one reason they may want to join is to help researchers learn more about these complicated diseases. What we learn might benefit people suffering from ARDS, pneumonia, and sepsis in the future. Patients and their alternative decision makers can choose to join the APS study or not, and participants may change their mind at any time. No matter what you decide about participating now or in the future, the doctors in the hospital will provide the best care for patients.
If you are interested in taking part, you will be given a document with important information about the study. This document is called an informed consent document, and it has all the information about the study and who to contact if you have further questions. After learning about the study, we know you may still have questions. Please feel free to talk about the study with your family, friends, and doctor before deciding to participate. Thank you for learning more about the APS Consortium study. We are grateful for your time. We hope you will choose to become a part of this growing community of patients and researchers working together to find the best treatments for these conditions.